My name is Jean-Luc Delafontaine. I'm a heart surgeon. I work at HCA, Florida Heart and Lung. Our patients range in age from, sometimes as young as 20s and 30s for thoracic procedures, infectious lung diseases and things like that. And they go all the way up to their late 90s in some instances where they have tight aortic valves. We'll do TAVR procedures or valve replacement through the groin. So people really run the gamut from anywhere in their 20s to late 90s. Operations that we do most commonly of open heart actual operations would be coronary artery bypass grafting. You've probably heard of people saying I had a triple vessel bypass or a quadruple vessel bypass. So those are things that we do to help restore blood flow to the heart. I have a special interest in total arterial revascularization, meaning using arteries instead of veins to restore blood flow to the heart. Some data shows that that's a little better for younger people. My approach to my patients is actually very simple. I treat everybody like they're my mom, my dad, brother, sister. And it makes things much easier to communicate with them because they know that you care and it's simple. And they've never, asked a question that you don't know how to answer. You just always explain it very simply. We are the Society of Thoracic Surgeons 3-star program, STS 3-star program, which is the highest accolade that you can have bestowed upon your program in the United States, and we are one of those programs. We do a very high volume of open heart surgery as well as lung surgery, and we have an unbelievable team, a very cohesive team. I'm fortunate to have an excellent partner, Dr. Sandwith. In the ICU, everybody has a voice and everybody talks about what the best thing for the patient is. We have critical care right there. We have our great physical therapists who walk the patients like immediately in the morning, and they get up and get out of the hospital pretty fast.